So since then, the past 6 years, there have been 7 million deaths around the world, 1.2 here in the US, which is a lot. I literally remember also, having to go everywhere with a mask on, and to think and see someone without a mask was kind of like a gasp, if you will.
Yeah.
And so it wasn't until, in doing some research, 2023, so May of 2023, that the pandemic was declared by the World Health Organization over. And so 3 years of what's happening, and people just being scared. And so backtracking, late 2020 is when we started to see vaccinations like Pfizer, Moderna, Johnson and Johnson. And so really just a full whirlwind of studies. Now we're seeing different variants, over the past couple of years. So it's doctors are referring to it now as an endemic. So something like the flu-like symptoms, but there are those differences that I can remember. I've had it maybe 4 times, which is kind of embarrassing to say. Yeah, I know. I was actually the first in my family
4 times
to get it. Yeah. And so that leads me to long COVID. So you can sometimes have those post-COVID, effects, symptoms, and that's something that doctors are looking at now. So we'll have the chance to talk to them about what long COVID is and how you can mitigate those symptoms. So yeah, even though it's no longer a pandemic, still very relevant, and very much, you can definitely contract it. So.
What is the number one tip that doctors are telling you right now?
Yeah, I think it's with flu-like symptoms, honestly, just making sure that you're washing your hands, staying clean as possible. If you feel symptoms, to definitely kind of isolate that thing where, we were in quarantine. So definitely just, those basic everyday cleanly symptoms, or cleanly, things that you'd want to do to kind of reduce any virus or flu-like symptoms.
And so you're talking to doctors today.
Yes.
And anything else that they're telling you?
Yeah, so I'll be speaking with them later today, but definitely just making sure that I would suggest to anyone, if you feel like you might have flu-like symptoms or COVID, to definitely contact your primary care.